Welcome, everybody. I'm Donna Meltzer, CEO of the National Association of Councils on Developmental Disabilities, NACDD. Thank you, everyone, for joining us today. Thank you to our network, our partners and friends who are all joining us for this very important conversation we're having today. We are here today to talk about Native American and tribal communities and to have a discussion on COVID-19 vaccines, which is an important part of our overall GetOutTheVaccine.org campaign. I want to thank our sponsor for this event, Pharma and the PharmaCare's grant program that made this event possible. I also want to recognize the support from United Healthcare Community and State that helped us launch the GetOutTheVaccine.org campaign across the nation earlier this year. I would also like to thank the Montana, Wisconsin, and Alaska DD councils for their help in identifying the speakers you are going to hear from today. This is a very important discussion, and NACDD is proud to host this community-focused event during National Native American Heritage Month. During the course of this conversation, we welcome you to submit your questions via the chat or to email them to COVID, COVID, @nacdd.org. I am honored now to introduce our speakers for the conversation today. First, we have Dr. Cheryl Funmaker, a board member with the Wisconsin Board for People with Developmental Disabilities. Dr. Funmaker is a warrior clan member. She grew up in, I hope I'm saying this right, Monaco, which we know today as Minnesota. Her father was a member of the Saha Standing Rock Sioux tribe, and her mother is a Ho-Chunk tribal member. Dr. Funmaker resides currently in Nishla, or as we may call it today, the Wisconsin Dells, with her family and relatives. Cheryl has had the pleasure to serve in the field of American Indian education for over 27 years. Most recently, Dr. Funmaker supports Ho-Chunk children with disabilities and their families as they navigate special education. Believing in the power of community, Dr. Funmaker collaborates with a variety of agencies throughout the state to build connections amongst Wisconsin's tribes for their children with disabilities. Thank you for joining us, Dr. Funmaker. Next, we have Mr. James McNeely of the Blackfeet Nation in Montana. Jim is the Public Information Officer for the Blackfeet Nation in Montana. The Blackfeet Nation has worked with the Montana Developmental Disabilities Council on outreach in their community. Jim and the Blackfeet Nation have been featured in the New York Times and other publications for their outreach and strong results in providing COVID-19 vaccinations in their territory and expanding their reach across states and countries to increase vaccinations. Thank you for joining us today, Jim. Last but certainly not least, we have Grant E. Varvel of Alaska and Alaska's Southcentral Foundation. Grant is originally from Colorado and moved to Alaska in January 2007. He attended the University of Alaska, Anchorage, and graduated in 2010 with a BA, a Bachelor's of Arts, in Sociology, Grant has been a Medicaid waiver coordinator since January 2014 and joined the Southcentral Foundation team in the fall of 2020. He has worked in the field of disabilities since February 2011, where he started his journey providing direct care supports to individuals with intellectual and developmental disabilities on Medicaid waivers. As you can see, we have a stellar panel for you today. We will begin by hearing from each of our panelists, and then following their more formal presentations, we'll enter into some dialogue with them and hopefully have some time for your own questions and answers. Oh, let us begin. Dr. Funmaker, I turn to you first.
Thank you. Hello?
I hear you.
Okay, sorry. I live on reservation land, tribal land, and my internet may act up every now and then, hopefully not during this presentation. I'd like to begin and typically in our communities, people an event. And so what I'm just going to say is that we're gathered here for a good purpose, and we're trying to do good things for our people. And I'm grateful that we're able to do this. And I'm going to begin. So my name is Cheryl Funnicker, and I work with the Ho-Chunk Nation. And I have been wearing multiple hats, and I'm a parent of my youngest son, who has a developmental disability. And I also have a doctorate in special education, and I'm a vested member of our community. So I bring all of these different perspectives to the work that I'm able to collaborate with our people, as well as with the agencies throughout the state. So I guess to open the presentation, what I'll say is that with the pandemic, the services that I've been fortunate to tap into have been through multiple systems, the health field, IHS, also the state. I collaborate with DPI, and also I've collaborated with the board, the Wisconsin board. And in each of these collaborations, we've approached the pandemic through a community-led endeavor, which is probably the single most important factor in making headway with vaccine hesitancy. And particularly, this is important as we've reached a plateau with vaccination. And we're going to need to push past that, especially as the vaccines are rolling out for our young people. So with a grounds up approach, I have a family group that we maintain and have maintained through the pandemic. Prior to the pandemic, we would meet every other month and have a meetings with families to bond with one another and present information on how to access resources that many of our families may not know how to or know of, waiver programs, things like that. And so this is still the same approach being utilized right now during the pandemic. We're going to rely, or we do rely, on our relationships amongst our families in the family group. And we try to be respectful in light of the history that contributes to vaccine hesitancy. And we still try to include people who don't feel comfortable yet with getting vaccines. And so the work, what I'm going to say is there's a lot of work to be done. And so the game is a long-term game. And so we've made smaller gains right now. And so, the end goal is to not exacerbate health disparities for our people that may happen, coincide with the pandemic. And so the primary vehicle, like I said, is maintaining a family group. We have a group on social media, and so this group, we access resources from the different fields that are typically siloed. And what I mean by that is we may have resources issued from our State Department of Instruction. We may have other resources from the board and a totally different set of resources through our health departments. And so working across multiple systems is very important. I think it's important for agencies to tap into tribal-based services. Many tribes will have youth programs, and that's kind of where I come from, you know, in terms of the services that I've been able to put out there for our tribal members. And I think I will conclude.
Thank you so much for sharing that. I look forward to engaging in some questions in a short while. Let's move next to Jim McNeely. Jim, please share.
Okay, Nixo ko mistoko ka misaminats kami nito to skapi kani kwan hanak kamok si Nixi manifestimi na COVID-19 ano kamok si Nixi amot si Nixo ko naka tomatapa po si nakya es systemic si asokenokix asokenokyakix anokya naka nixi pokek si sitsiman nixi matapik si stabiman na nixi. Good afternoon, everyone. Thank you for inviting me to be part of your panel today. I'm James McNeely, and my Blackfoot name is Longtime Medicine Pipe Owner, and I'm from the Amaskapi Pikani South Pagano, the Blackfeet Nation of northern Montana. And like everyone else throughout the world, we have suffered greatly from the COVID-19 pandemic. Being on an Indian reservation, we have approximately 17,000 tribal members with around 9,000 living on the reservation here. We border Canada right here in Montana on the Blackfeet Reservation, as we have three other sister tribes there that we share the border with. So this pandemic and border closure has caused some great grief amongst families, being able to see one another, being able to cross the border freely. It's interrupted daily life and ceremonial life and social life like it has throughout the world. And so the approach that the Blackfeet Nation took, we closed the reservation down starting March 15th, 2020, and we remained closed until March 15th, 2021. But during that time, we kept COVID at bay until around mid-September. After the CARES funding came out, our tribe decided to help families with a $500 payment. And after we did that, we've seen an outbreak of COVID here. And our highest case was in mid-October, where we reached 397 cases. And of that, to date, we have lost 54 people to COVID-19 between the ages of 20 years old and 80 years old. 95% of them all having underlying health conditions. I introduced myself in our Blackfoot language, which is something that's scared of being lost right now. And so with the border closure, that did kind of interrupt that, because a lot of our speakers live on the Canadian side. And so we had to come up with a word for a new sickness for COVID-19, and the word is manifestimi, which means there's a new sickness. So that's what we've had to develop. And so when the vaccine rolled out end of mid-December, the idea was, of course, we received the Moderna. The idea was to vaccinate the most vulnerable and the frontline workers, which we did in a timely manner. But we were receiving both vaccine from the state of Montana because of our tribal health system working with the Department of Health and Human Services in the state. And we were also receiving vaccines from the Indian Health Service at the hospital. So we were getting, instead of just 100 a week, we were getting 200 a week. So it was doubling. And we fairly quickly got our frontline and vulnerable vaccinated within the first month and a half. So then we opened it up, and within 2.5 months, we were at 90% vaccinated within 3 months' time. By March 1st, we had reached 90% vaccination rates. And so we were featured all over the different news and everything. The other thing was, so once we got our people vaccinated, we had they were still sending the vaccine. So we reached out to other communities around the state of Montana, and we had people driving from all over the state coming to get their vaccine from us. Well, we still had an overabundance, and one of the ideas that one of the nurses and I had was, hey, instead of wasting the vaccines, why don't we check with our northern relatives? And so we checked it out, and we worked with the state. We worked with Department of Homeland Security. We worked with Canada Border Services, with the tribes up there, our sister tribes, the government of Alberta and the federal government. And it opened a door. And so we started vaccinating our First Nation members up there. But then a lot of folks in Southern Alberta asked for their vaccines. So we said, why not? We're Indian people, we're giving, and we said, why not just vaccinate as many as we can? So we did. We vaccinated approximately 2,000 folks from Canada, both First Nation and non. We even had a gentleman fly in from Toronto to receive a Johnson & Johnson and flew back out the same day. He made the 3-hour trip from Calgary and down to the border. And so we just overwhelmingly we're grateful for the vaccine, for the push that we did. We you know, Indian people are so close knit. We promoted that if your grandma gets COVID, she might get sick and die, versus me being a young guy and being able to probably get over it. And I unfortunately got COVID in September. You know, with both vaccines, and people have to understand that you can still get it with the vaccine, just probably not. I had mild symptoms. My 12-year-old he was asymptomatic. My wife, she has health conditions, but she was pretty good. The only thing, we're still having a little bit of after effects, but you can still get COVID. And so we're still trying to push becoming vaccinated. The boosters now, a lot of our people have received the booster. We're still vaccinating people. We are kind of heading up on a spike here. We've had, we're sitting at 75 active cases today for our reservation. And so just this overall push to get people vaccinated, no matter what. COVID knows no nationality or no race or anything. So getting people vaccinated was our main goal. And so that's why we're honored and proud to be part of this panel today. And I've been with the incident command team since day one when this all started. So that's why I've been asked to join, and I thank you for that.
Thank you so much for sharing those opening comments. Let me now turn to Mr. Varvel Grant. Please share what you've got for us from the great state of Alaska.
Yes, hello. It's a pleasure to be here and an honor. Appreciate the opportunity to speak with everybody today. I'm gonna try to share my screen in a second. So give me one moment. All right. Are you guys able to see that? Are you guys able to see my slides?
Yep.
All right. So, all right. Like Donna had introduced, my name is Grant Barkle. I'm a Medicaid waiver care coordinator here in Anchorage, Alaska, working at Southcentral Foundation. Just a little background about myself. Like Donna had said, I'm originally from Colorado and moved up to Alaska in 2007. I've got about 11 and a half years working in the intellectual and developmental disability field here in Alaska, ranging from providing direct supports to adults with autism, and then supervising staff that would work with those folks in their private homes and natural homes. And then for the last 7.5 years, working as a Medicaid waiver care coordinator. The Medicaid waiver here in Alaska, we serve individuals with varying disabilities, intellectual and developmental disabilities, children with complex medical conditions and the growing aging population. My role in their lives is to help the individual with a disability navigate the Medicaid waiver program by applying for the Medicaid waiver, reapplying, identifying the different needs that individual person has, the services through the Medicaid waiver that can address those needs, and then identifying the different provider agencies that can provide those services through the waiver. And my biggest role and most important role is to help people make informed decisions. Southcentral Foundation, we're an Alaska Native owned nonprofit healthcare organization. We are the largest Cook Inlet region nonprofit. We serve about 65,000 Alaska Native and American Indian people. We provide a myriad of healthcare services ranging from primary care, behavioral health, occupational therapy, physical therapy, and I believe we have approximately 80 different departments here, and which includes where I work as a Medicaid waiver care coordinator. And this slide shows the state of Alaska, indigenous peoples and their languages. And I just kind of wanted to show where the Cook Inlet region is to give everybody an idea of where we're at. And so if you see that yellow circle towards the middle of the screen, that's approximately where the Cook Inlet region is. The COVID-19 pandemic has really had great impacts on the IDD community here in Alaska, just like it has across our nation. Early on, there were a lot of limitations on people's routines and the things that they could do, and activities and places that they could go. And changes in routines can be quite challenging for this population. And so this was a great struggle. Folks having to get used to wearing PPE, and one of our biggest and lasting impacts is staffing shortages that can work with our population. Some of the silver linings is that virtual service delivery options have kind of really opened up accessibility towards services. Folks residing in group homes that needed to stay at home were able to engage in their rehabilitation groups and group activities through Zoom delivery. The health screenings was a preventative measure, so people entering into the various group homes or assisted living facilities, healthcare facilities, having those health screenings was a great preventative measure. Heightened awareness about hygiene practices. But we've had a great strain on our medical system up here, and bed shortages as our numbers have increased. And like I said, we continue to see great staffing shortages, which makes it difficult to deliver the services that people need. So when vaccines started to become available here in our state, my personal conversations with the customer owners, the clients that I serve, were really tailored to the specific individual, to their guardians, their loved ones. And some of the the concerns that seem to be brought up more consistently were, people being worried about, is it going to worsen my current medical situation? I'm concerned about side effects, just overall fear of shots in general. Transportation seemed to be a barrier, and the idea of, has anyone like me gotten vaccinated yet? And the resounding theme of those conversations seemed to be going back to the people that they trust and talking to them, especially with their primary care physicians and medical professionals that they've trusted with their health care prior to the pandemic. And throughout some of those conversations, there were themes of motivation that people had with this population. They wanted to protect their own health, protect the health of others, their family, but then also getting back to those routines that they enjoyed prior to the pandemic, especially when it came to social activities. At Southcentral Foundation, we were able to administer the first dose of the vaccine December 15th, 2020, at the primary care clinic here. We started a vaccination clinic that ended up being a very well-oiled machine. And that began in January 11th. We were operating that 6 days a week through March 6th, and then dialed it back to 5 days a week through April 30th when the clinic ended. And 8 to 6 p.m. Providing that service to people, and then 8 to 5 during the 5-day-a-week period. Total vaccines that we were able to administer with that clinic, just shy of 48,000, just over 17,000 of which were Alaska Native or American Indian beneficiaries. And we had opened it up during the clinic to employees and then to household members of those employees. And then towards the end, opened it up to the community at large, so that there was, giving back to the community and making sure that we were doing what we could for everyone, for the greater good, and not wasting what we had. And this graphic here is a summary of the different doses that we have been able to administer as of yesterday, and shows the different age groups of the impaneled customers who are impaneled to receive services here at Southcentral Foundation. And you can see as the age groups get older, the percentage of the population increases with their vaccination rates. So you get to the 85 and up category, where there's about a 7 to 8% decline from the previous age group. And that wraps it up for me. We're in this together. I wanted to provide a few links if anybody wanted to look into what we have here in Alaska. So there's a link for the Senior and Disability Services, our Southcentral Foundation website, and then the University of Alaska Anchorage Center for Human Development have also done a vaccine survey for folks with IDD, and so there's a link for that, and I'd be happy to forward that on to you, Donna, so you can disseminate that if you would like.
Wonderful. Thank you so much, Grant.
You're
Great opening presentations from all three of you. If I could invite you, please, Dr. Funmaker and Mr. McNeely, to also come back onto the screen to engage in some conversations here. So as each of you were speaking, I noticed some commonalities, right? There are certain things that, regardless of what state you're in, what tribe you're speaking to, or you know, whatever the population, we all have some common things. So one thing I picked up on here is regarding language. You know, as folks working in the IDD space and across so many different parts of our country, we recognize that language is important. There's language in the sense of plain language and language that is easily understandable for people with cognitive and intellectual disabilities, but there's also native languages and being able to communicate in your own native tongue. And that, I think, also leads to feeling that comfort that you are hearing from your own community about something that's important. When I think back to the very beginning of the pandemic back in March 2020, one of the things that we were needing to do very quickly was message out in a variety of languages to people in the IDD community, to their families, to their caregivers, to their friends, to make sure that everybody had an understanding of just how dangerous this new sickness, as Jim's language referred to it as, just how serious this was. I'd love to hear a little from each of you, how you manage this within your populations that you represent, how you looked at your own languages, your Native Alaskan tribes, your Native Indian tribes, and how did you manage? Did you work with a variety of folks within your local tribes, within your networks to help get word out? Did you use one standard language? What modalities did you use for communication? I welcome any of the three of you to jump in and start the conversation.
Sorry, I was on mute. So let me make sure I'm understanding that right. So you're just wondering how we promoted the vaccine all in together?
So how you thought about language. You each represent tribes and Native communities that speak their own language. Did you use their own language? Did you use a variety of different languages? How did you begin thinking about the best ways to communicate?
Well, one
your
of the
population?
ways that we started to do it was we don't have a lot of speakers of our language left anymore on this side of this side of the border. And so I have a stuffy nose. I just got to let you know, and that's an after effect I have from COVID. I have blocked ears, stuffy nose, a sinus headache. And so the doctors told me that could be anywhere 3 to 6 months. So I might see me, because it has, that's what we evolve. But what our promotion was just using our elders and our children, because our people know, everybody knows that our children and our elders are the most vulnerable. And so utilizing that is what got our people out there. We did offer incentives by gas cards, coffee shop cards, to the grocery store, just little incentives to get people to get vaccinated. But and then we used a cartoon, and I need to find it. I'd like to send it to you all. We had one of our Blackfeet language speakers use a little puppet, and he spoke in Blackfeet, then he did in English on getting your vaccine. And so it's real cute, and that really hit it off. I'll try to find it and post the link in the chat there, but just overall promotion of how important it was to save your life. The loss of our language, the loss of our culture, the loss of our identity would have been detrimental, just like the other tribes. If we would have lost more elders and speakers, then we would have been in a bad place. And so that's how we took the approach. The local newspaper, radio, Facebook, everywhere, we just overall promoted it. And so that's how we stuck. And of course, we respect the people who do not wish to get vaccinated, and so, but we really try and promote that you get it. So that's how we did it. That was our communication to people.
Wonderful. Thank you for sharing that. Grant, did you want to, I know you put up that slide that showed all of the different communities, and I imagine there are some different languages wrapped up in that as well.
Yeah, tons of languages spoken here in our great state. So in my department, we have some UPIC speakers that were able to help communicate to some of the folks that it would be better understood through their native language. Same with primary care. We have got a large primary care system here that utilizes our elders and other employees that speak the native languages across our state. And going back to the concept of communication and getting the word out, personally with the population and the customer owners and clients that I serve, their cognitive understanding differs. Their situations differ due to their disabilities, and so tailoring those conversations specific to each individual person seem to be successful. And storytelling is a very big part of our cultures up here. And so when people would ask me, has anyone else like me been vaccinated yet? Has anyone else like me got COVID? And like me being their culture, their disability, all of that, and being able to either connect them with other families who have had experience with it, letting people know, about the folks that I know that have had experience with it, that seem to help. I've had numerous clients be hospitalized prior to a vaccine being rolled out, and friends and family members that have been hospitalized. And I think those stories and those experiences helped as a motivating factor for some folks. Yeah.
That's beautiful. I love, that connection to storytelling. I think across DD councils, storytelling is a very important part of what we do. Sharing those important cultural references and talking about how I think, how I feel, what matters to me, what my experience has been a motivating factor. Something else that all three of you touched on in your remarks about needing those motivational factors, making sure that each individual who is considering vaccine could see that other people like them, who looked like them, were getting the vaccine and having success with it. So thank you for sharing that. Dr. Funmaker, tell us a little bit about language and culture within your tribal communities in Wisconsin and how that played a role in folks getting vaccine.
So, pardon me. I know with our tribe, we have when it comes to anything like a campaign, our people will approach our elders. We have a traditional court, which is comprised of our clan leaders, and people go to them and say, this is what we want to do. Do you approve? Do you have suggestions? We also have another one called Clan Mothers, and we do the same with them as well to get their input and approval. And so then we also will collaborate with our, we have a language program, and they will be approached and asked about, what to, how to translate appropriately, whatever the campaign is. And so in the case of COVID, the campaign that was put forth by our health department, and we piggybacked off it for our family group. We have a value that is to love one another. That's one of our teachings, and we have a song for it, and we sing it all the time. So the teaching we have for our purposes is Wochadekiwi, and that is what we provided. We did a vaccine campaign for our families, and actually it's not done yet, but we're going to be, we have shirts with some native designs on there and the terminology, Wochadekiwi, and then we also have some other phrases like get vaccinated on the shirt, and then there's a couple other phrases that I can't quite remember right now, but we try to incorporate the teaching with the language. So from my perspective, what our tribes have been doing, not just us, is incorporating the value so that our culture can continue, and so that we can also live our value to be a good relative. And so we kind of infuse the values and find the language or get approval for the language. And so that's how it's tapped into. And I want to say that, I know we're tribal representatives here, but, we also have a significant number of people who don't live on the reservation and who live in urban areas. And so in those cases, I know there's urban Indian Health Services where they will have connections to tribal communities as well, and then also still try to reach the people in the urban settings nationally. So, and I want to advocate for that because for our tribe, what we do is we also serve our tribal members wherever they may live throughout the state or the country. And we have tribal members who live in different countries even. So we try to include, in our thinking, in our services, how we can meet the needs of everybody wherever they're at.
Excellent advice. Thank you so much. I want to turn to talking for a couple minutes about the newest population to be eligible for vaccine, and that is our youth, ages 5 and now up through 12. We already had the older set of youth, but now younger children. And Dr. Funmaker, let me stay with you for just a moment. You mentioned in your opening remarks that you were feeling like you were kind of at a plateau in terms of where you are with vaccination rates. Is the ability to vaccinate more of our younger children now, do you feel like that may help lift you out of the plateau? And are you doing any special messaging or doing anything differently to really get to families with young children?
So in our case, we're still we're not completed with our campaigns. They're going to be ongoing. And so, that's going to be the biggest important factor in addressing hesitancy. I think there may be more hesitancy when it comes to children in the vaccine. And so, in our case, our tribe, our health services is really doing a fantastic job in removing systemic barriers to vaccination because we live all over in our state. And so we have like a traveling van that goes from community to community and provides vaccines and things like that. So, you know, making sure the barriers are gone is important, but also in order to address hesitancy, you really have to have an authentic relationship with one another, you know, to have frank conversations, you know, and opportunities to address the concerns. You know, they're valid because they have them. So you know, it's ongoing. So I kind of veer off questions. So redirect me if I veer off too much.
No,
But
you're doing
anyway,
great.
yeah.
Yeah, thank you. Grant, you showed us a slide where you had numbers kind of related to ages. So clearly in Alaska, you're also on the bandwagon to reach families of young children. Tell us a little bit more about what you're seeing there. Is there greater hesitancy because of the young age, or is it equivalent with any age or different issues? Tell us your thoughts on that.
So my current experience when it comes to age and children is that there seems to be a great amount of hesitancy with any child and any parent. You want to make sure that you're doing what's best for your child, and I think that, you know, turning the conversation, you know, into, you know, a heartfelt conversation about, you know, getting in touch with their medical providers and having that conversation with them, talking to their families and loved ones, looking at, you know, our current situation in Alaska and the strain on our healthcare system, and you know, helping people to have that informed decision as to whether they want their child to have the vaccine or not, and weighing the pros and the cons, and looking at the what ifs, you know, and the risks involved, and again going back to storytelling. And helping people relate, connecting parents with other parents that are in similar situations, but having those open and frank conversations like Dr. Funmaker had said.
Yeah, thank you. Jim, did you have any thing to share also around how you're reaching the youth?
Yeah, so while I put you on mute there. I was actually, today we're having the vaccine clinic for the youth. It's right in front of me. They're kicking it off today, 5 to 11 years old, and then 12 to 18. We have some of the younger nurses doing the shots. The school is working in conjunction with us. We're offering them some Gatorade or popsicles or suckers after, you know, for the smaller ones when they get their shot. We ordered some incentives, you know, little face masks and stuff, because we still have a mask mandate here on the Blackfeet reservation. Vaccinated or not, you have to wear your mask in all areas of the reservation, period. And I don't foresee that in for the next couple of years. And so we're just really doing our best to try to get our young people out there. If they need a ride, there's people picking them up. They're trying to do them at the school area, and so that way they can it's more accessible to them. And so we're just we're working diligently, and that's where we're at today.
Excellent. Thank you for sharing that. Jim, I want to stick with you for a moment. You, in your opening remarks, you talked a little bit about how you were successful in getting some media attention on your population, on your nation, and things that were going on. And I think you might have a story that you want to share about how you connected with the New York Times for an article. Is that correct?
Quite interesting. Well, yeah, I mean, it's interesting because when we first started the news, the local stations here in Great Falls, Montana, normally catch up on our stuff, and they started just coming up to see how things are. We have a reporter who's really good to us. And so she did a little story. Well, then somehow it went on their webpage, of course, Great Falls Tribune, KRTV News. And it was, then we seen it on Yahoo. Then we seen it on USA Today. Then we got a call from New York Times. Then we got a call from an Australian filmmaker. Then we got a call from CTV News in Alberta. Then we got a call from, so the media was very good to us in promoting our vaccine and rate for us, just because of the friendship that we have being in rural Montana. You know, yesterday we surpassed, 2 days ago on the news here at Montana News, we surpassed half of the people in Montana are vaccinated now, and that's 500,000. So there's more people in Denver than there are in the whole state of Montana, you know. And so getting vaccines out to people in this rural area, 26 miles south of Browning, where the majority of the people live, in all of the stores and the hospital are, there's a small community called Heartbeat, Montana, and they have a small school, and they still have a close-knit community who's very traditional. You know, it's those folks that we had to get out to. And like Grant was talking, we have a mobile vaccine unit too. That's how we were able to go all over. That's how we went to the border. Was we went around and we brought it to them versus them coming to us, because a lot of our people, we do have a high rate of poverty on the reservation. A lot of people live month to month. We don't have access to a lot of things because we're out in rural Montana. You know, we don't have the best, like Cheryl was talking. I'm really surprised that I haven't cut off on the internet yet, because we don't have the best internet out here in rural Montana. And it's like that on most reservations that you see that there, but hopefully with the infrastructure bill, we'll get some better internet to different places. So getting that to the media was just something that they've been following us through on our Facebook. They're friends with us on our Facebook page. So anytime they see a story, our media people call me and check in on what's going on. Then it turns into a bigger thing. And then pretty soon I see it out on different links, and it's usually on Yahoo or MSN as well. So it does reach out into the national, international areas as well as state and local.
Wow, that's really quite amazing. And I think, you know, in our world today, getting some of that media attention, we know is impactful. It gets us further and wider, whether it's traditional media or it's social media. Are Grant or Dr. Funmaker, are either of you using media, whether it's traditional or social media as well, to get your messaging out and to reach more people? Go ahead, Dr. Funmaker.
Yeah, so as part of our family groups, we have a Facebook group, a private group, and it gets quite a range of people that from birth to adulthood, meaning you know, people, tribal members with, you know, caring for or themselves with developmental disabilities. So we have a Facebook, and so far, knock on some wood, I'll find some wood. That's been a pretty good informal support as well.
Yeah, and personally, with the clients that I serve, the customer owners, I haven't used social media, but I know that Southcentral Foundation and ANMC has had a great presence as far as articles go in, you know, television ads and things like that, which has helped to spread the word.
Wonderful. For the last question that I have before we wrap up today, boy, an hour goes very quickly, doesn't it? What advice would each of you give? You know, we have a lot of folks on through Zoom today. We have many who are watching this through YouTube or through Facebook. And of course, this will is being recorded and will be posted. So I know we have lots of folks across the nation who are also serving Native populations. What advice would you like to share for best practices, things that worked really well for you, or it could be the opposite, what not to do, what didn't work? So I want to give each of you an opportunity to just briefly share whatever thoughts you've got in terms of something that you would like everybody listening to know. Let's start with you, Grant.
Yeah, thank
Put you on the spot.
I appreciate it. Thank you. The biggest resounding thing that I can think of is connecting people with those that they trust, and seeking advice from their medical profession. You know, before the pandemic, people have trusted their primary care physician to handle, their health situation, the effects they may have from their disability, their day-to-day routines, and then the pandemic hits and everything goes crazy. Having that information from them is very important, and also, like I've been talking about, connecting people with others who have had experiences, and being able to share their personal stories about some of those questions and concerns that people had initially. I'm concerned about side effects. Well, I know this family that has had both of their children who experience a similar disability. Would you like me to have them reach out to you, and so that they could share their story? That seemed to have a great effect. People make the best decisions when they can be informed decisions. Yeah.
Well said. Thank you. Dr. Funmaker, any advice for other states and other folks listening today?
Yeah, I think that when we were working on the vaccine campaign and moving forward, if an opportunity exists, to address the vaccine for children, the parents in our group were thrilled to have the opportunity to share their thoughts about, why the vaccine was positive and the things it did for their children. And so, I have parents who are wonderful advocates, and having the opportunity for them to share their perspective, I think is going to really go a long way. I've seen, because of parents being encouraged to say, perhaps, I had one parent say that the vaccine was important because being quarantined at home for a year was not at all helpful for the social skill support that their child needed. And so that kind of perspective isn't typical, but it's important. And it's when we have, avenues to support the voice of our parents or our young people, then I think that that is going to go very far. And so I think that in our case, having a very strong relationship with the board has been crucial in a positive way. And so, across states, developing a singular relationship or not singular, but a close relationship with a tribal community, ideally more than one, so that our people have a voice, to share the perspective that needs to get out there, especially for our children and young people with, developmental disabilities.
Thank you. I believe that Jim had to step away, and we are just about at the end of our time. I want to thank you all so much for presenting today. Thank you, Dr. Funmaker and Grant and Jim. Your perspectives are so important to us, and for all of us to learn more about the successes you've had in your states and with your communities. And I hope that you will continue to have as we continue to meet all of our goals in getting vaccination done for all ages, including booster shots for those who are interested in that. We certainly hope that most people will receive the booster shot soon as it becomes more widely available. I do want everybody to know that we will be sending out a link to this recording. You are welcome to share it out with your networks, your families, your friends, and others who you think would benefit from seeing this. It will also be posted on www.getoutthevaccine.org. I again want to thank our sponsors for this program today, PharmaCares and United Healthcare. It's been such a great opportunity to learn and to grow together here today and learn about other populations and best messaging, best ways to get vaccine out there. Continue your good work, everybody. We need more vaccine angels who are out there and people who are getting to their communities and really making this happen so that next time we'll be doing this live perhaps instead of over Zoom. But this has been wonderful. I appreciate everybody's time today. And also, if you have any follow-up or further questions, feel free to reach out to us at NACDD@nacdd.org or to your state DD council. Thank you all for joining us today. Have a great rest of your day.